I think that one of the tragedies of modern medicine, at least in this country, is that people have relied on mammograms for so long to diagnose breast cancer. And it really hasn't turned out to be as good as we wanted, and in fact may be dangerous. Patients are overdiagnosed, they're overtreated, and the treatments aren't benign by any means. Chemotherapy, radiation, for tumors that really wouldn't ever cause them a problem. But it's extremely hard for a patient to sit on a diagnosis of a precancerous lesion and not want to go and do everything they possibly can for it because they're frightened. And it really is all about fear. The media promotes this, the medical profession promotes this. It's a total waste of healthcare dollars for annual mammograms to be done for everybody. There's recent studies that have shown that an examination by a physician once a year is as valuable as a mammogram in terms of longevity. And on the mammogram side, more tumors are diagnosed, but they don't need to be, and they don't need to be treated. Patients are just living with a diagnosis of breast cancer when they really didn't need to at all. So there are other imaging techniques now that are more predictive. They may not be as good at mammograms as diagnosing a lesion, but they're more predictive. And we can see abnormalities in thermography, for instance, that are precursors to cancer and that can be changed with a change in diet, a change in medicine, a change in lifestyle, all those types of things. And ultrasound, of course, is very valuable in the diagnosis of lesions. And in this country, gynecologists don't deal with breast disease very much. In Europe, gynecologists are the breast surgeons. And so, having been trained in Britain, I am familiar with those pathologies, and I feel that it's part of the care that I have to give to patients. So I'm able to do fine needle aspiration or biopsies of breast lesions that maybe most gynecologists wouldn't be doing in their office. But I think the society needs to be re-educated on the worth or lack of worth of mammography, because I think it's a travesty.